Well, good morning. It's Dr. Brian McKay, not just a chiropractor, Stanford, Derry, and Norfolk McCain. And I always apologize for the long-winded title because, yes, I am a chiropractor, but that's not all we do. And what I want to talk to you today about is the problem that people have with peripheral neuropathy. And what happens is, numbness and tingling doesn't seem serious. If you're in pain, you're going to act on it. If you're not in pain, well, let's take this medication and see what happens. But loss of sensation means the nerves are not working. And a lot of times it's due to a couple of basic things. Um, Diabetes, it's too much sugar. Sugar destroys the covering on the nerve. And if the other one would be chemotherapy, the toxins in chemotherapy will erode the covering on the nerve, not allowing for proper nerve transmission. Nerve transmission is supposed to be at about 270 miles per hour. When it doesn't happen, your brain's not getting the information quick enough. That's a bit of a problem. There's idiopathic types of peripheral neuropathy. We won't go into that today. Another one would be alcohol-induced. If you drink too much, that can induce neuropathy as well. Pretty much along the same line as diabetes, the sugar and alcohol will kill covering on the nerve. The covering on the nerve allows for faster transmission of nerve impulses from your brain to the body part and body part back. Doesn't happen, you lose sensation. Now, the problem is you don't always know you're losing sensation. So this is one of the most common symptoms of peripheral neuropathy. But it typically hits the hands and the feet because they're the furthest away. Furthest away from your heart, furthest away from basically everything. So the hands and feet, you just see it, that's no big deal. You pass it off as not being that important. But it can definitely create problems for you from a health standpoint because when you have a loss of sensation in the hands and feet, it can lead to increased risk of injuries like burns, cuts, ulcers. Like you have people who don't even feel like a nail going through their foot in severe cases. But the thing is, there's a continuum that you're on here, and that the condition will continue to get worse. And quite honestly, you want to take Lyrica, Cymbalta, gabapentin, all those heavy-duty anti-seizure medications that are commonly used to treat peripheral neuropathy. They don't really treat, they quell the symptoms for a while. When I say quell, it dumbs down the nerve. So you have a nerve that's compromised already, and you further quell it, it doesn't really help the situation. Now, another really important danger of peripheral neuropathy that you may not be aware of is balance and mobility issues. If you can't feel your feet, there's a problem because the nerves that deal with balance that go up to your cerebellum and switch over to the other side and tell the brain what's going on. So you understand, the left side of the brain controls the right side of the body and vice versa. Muscle weakness and numbness can affect coordination and balance, and they make falls much more likely. This is dangerous for older adults, and this increases the risk of serious fractures. Falls, a fracture can lead to nursing home stays. If you can't feel your feet and you trip over something, not good. So peripheral neuropathy has its dangers. Now, it also get the chronic pain. Now, pain, everybody can say, okay, I've got pain. I want to fix the pain. Give me something to fix the pain, doc. Give me something, anything to help this pain so I can go to sleep. And usually the pain is going to be worse at night. So the ongoing pain includes burning, tingling, or stabbing sensation, which can dramatically impact the quality of your life. And chronic pain does another snow job on you because what it does is it messes with the frontal lobe. When you're in chronic pain, you're not going to be the happy-go-lucky person you would have been without the pain. So we're touching on a couple of different things here: pain and numbness, loss of sensation, loss of balance. And, if you don't notice that you have, numbness, you may not notice ulcers on the bottom of your feet, and untreated wounds can become infected. I've had several people come in missing toes, feet, because they had to amputate these areas because of infections that have come about. So there's a real serious problem. People with peripheral neuropathy can have bones, ankles, feet, toes amputated because there's no blood flow as well. So that's another thing too, is you're not getting the same adequate blood flow, and blood flow is going to help heal that area. So the thing you're probably not aware of is muscle weakness and atrophy. The motor nerves, which control muscles, have issues. The muscle atrophy over time further impacts your mobility and your daily functioning. It's almost like it's much more difficult to put a key into a lock, try to open the door. Hold a cup of coffee or a cup of tea, in your hands. And you start to notice this. It's like it may seem as no big thing, but it is. And then there's a thing on top of it you might not understand. It's autonomic dysfunction. Um, autonomic is just the autonomic nerves and stuff in your body that control things you're not aware of. Your heart beating, your lungs filling with air, all these different types of stuff. So when you have autonomic dysfunction, it's not unusual to have an abnormal heart rate, fluctuation in blood pressure, digestive problems, and bladder control issues. So there's no neat package for you to deal with peripheral neuropathy. First of all, there are programs that we offer, which is why I'm doing this podcast, that offer a way to start digging your way out of it. And so I'm going to go into a little analogy and hope it makes sense. You have a covering on your nerve. The nerve is that fiber that connects to other nerve fibers that lead. There's a bunch of connections going all the way up from your pinky to your brain. The covering on the nerve is called the myelin sheath, and it's susceptible in the presence of too much sugar or toxins, like from chemotherapy and like diabetes for the sugar. What happens is that covering should be like a grape, and that allows a smooth, fast transmission where you're not going to have loss of sensation or balance, mobility issues, pain and infections and muscle weakness and atrophy. What becomes is it becomes more like a raisin. And when that covering becomes more like a raisin, you are clearly more susceptible to peripheral neuropathy and this whole host of things we just went over, the loss of sensation, balance, mobility issues, chronic pain, infections, autonomic dysfunction, like I said, blood pressure fluctuations, digestive problems, abnormal heart rate, and again, muscle weakness and atrophy. So what do? You go to your doctor. Well, there's really no cure for neuropathy. And I agree, there is no cure for neuropathy. But you can start to reverse out the symptomatologies and address the quality of life issues. Now, first of all, here's the big surprise. Guess what? Medicare doesn't cover it. So we see patients come in and we go through a whole treatment program. Our treatment programs last anywhere from 6, 9, 12 to 18 months. But this is your life, the quality of your life, and you have to decide, is it worth the investment you have to make to start reversing out and regain the quality of life that you should enjoy but are unable to? And if you rely on medications, that's fine, but it's not going to work. It's going to lead down a path where you're going to have further and further issues and further complications, as I've just mentioned in today's podcast. So what can you do? Neuropathy Core Health was started about 8 years ago. We started to see a really strong rise in the number of peripheral neuropathy cases. And what we do here is we have a program that's based on many cutting-edge therapies that are, I'm going to go into a few, like we do exercise with oxygen therapy. We do cold laser therapy to stimulate blood flow. We do vibratory plate to stimulate blood flow. We stimulate the nerve with the Hakamed, a German device that is a phenomenal treatment to wake nerves up and stimulate the nerves to regrow. So what happens here is there is a pathway to a better quality of life, knowing that the neuropathy is never going to be cured, because the neuropathy is secondary to a primary condition. You got cancer, well, these problems come about. How do you want to address it? Cancer is bad enough. Neuropathy makes it even worse. What I invite you to do is 203-875-0846. 203-875-0846. Give us a call. Come in. We'll run a test. We'll do a very simple thermal scan where we can see if you're getting adequate blood flow. We'll see if you're getting enough oxygen. That's probably one of the parts of the test. We'll test the nerves for different light touch, deep touch, vibration, hot, cold, and we get a better idea of a baseline of where your peripheral neuropathy stands. And then I'll present the treatment plan to you and see if it's something you want to pursue. Like I said earlier, Medicaid is not covered. Unfortunately, it doesn't, but I can't change that. You can change that in November when you vote for whoever you're going to vote for. I'm Dr. Brian McKay, and as I'm going to say, neuropathy of core health has helped many people overcome the complications that arise from peripheral neuropathy. I wish I could say I cured peripheral neuropathy, but I don't, and no one does. Can we make the quality of your life better? Certainly. Again, 203-875-0846. Be more than happy to call you back, go over a couple of things with you, any questions you might have. Feel free to give me a call. I'm Dr. Brian McKay. And again, I'm not just a chiropractor. Obviously, if I'm helping people with neuropathy, it's not a chiropractic condition because medical doctors aren't helping with neuropathy either. So I look forward to hearing from you. Thanks very much. 203-875-0846. Have a great day.